All right. So you wanted to introduce me, or I can introduce
Yes,
myself, whichever you prefer.
I will. So ladies and gentlemen, welcome to Back to School. As you know, most of you know that Back to School is a concept, and that concept is that we are specializing in our own trade, but we don't know much about the other trades. So this program brings in a lot of knowledge from other sectors that we are not familiar with. And we need those sectors and those issues to deal with in our daily lives. So this program is adopted and sponsored by the American Dairy Society, also known as ADS. We pick on the unique subjects and bring in the unique speakers, and today is no different. It's a classroom kind of setting. That means this is a teacher and student relationship. That means we don't debate, we don't argue, we don't challenge. We learn, listen, be supportive. Positive comments and editorials are always welcome. And once the lecture is done, we ask questions. You can put the questions in the chat box or ask yourself at the end of the presentation. And if there is a burning question that you want to have answered before she goes any further, then you can ask. So I'd like to introduce, it's my great pleasure to introduce Sabina Levine, who is a licensed agent in the state of California, to specialized in Medicare plans in our area, as well as a Medicare supplement broker. So you know, when you get Medicare, those of us who already have Medicare, we understand Medicare a little better than those who are coming closer to it. And that will be a lot of our group that will be coming to the Medicare age. So you know that the Medicare covers approximately 80% of your healthcare needs, and 20% is covered by the supplemental that you have to pay for. And there are a variety of programs that you receive in your mail that everybody is trying to sell you something or promise you that you will get free services. So all this science is quite confusing, at least to me. And when I met with Sabina, she started helping me out and created a kind of ambience that I began to understand that what's going on here with this Medicare and me specifically, and everybody may have a unique situation. So therefore, I thought that, I'll ask her, and she was very kind enough to go ahead and agree for this webinar today. Her services are, as you must have read in the brochure, are at no cost to us. So she will educate, she get paid by the broker. So if, let's say you sign up with United Healthcare, United Healthcare will give her her share of income, because she also has to earn livelihood just like we do. So that's why her situation is very, very unique, that she's going to educate and we are going to learn. And then if you feel like that your needs can be met by her expertise, she will help you out with the processing. So with that introduction, I would like to hand it over to Sabina for the rest of the evening. Thank you so much.
Thank you so much, Deepak, for that wonderful introduction. And good evening, everybody who's joined us so far. I'd like to show you that my contact information is displayed on the screen. And if you have any questions, of course, everyone has unique circumstances most suitable to their own needs. And we'll talk about that as we move forward. So if you want, I definitely encourage you to contact me if you have a very personalized question. But for the purpose of this presentation, we're going to be doing a basic overview in general of Medicare basics so that everyone has an understanding of the concepts involved. And I will take questions at the end of the presentation so that if anyone needs clarification on anything that we've discussed so far, then we can address them at the end of the presentation. So my name's Sabina Levine. I am a licensed and certified broker with all and most of Medicare plans that are available in California and other states in the country. And what's really important is to note that, for example, hold on one second. So this is a Medicare made simple. What it takes in terms of becoming a broker with Medicare, you have to be certified every single year So a little bit about myself. I am married, been with my husband now for 24 years, and I am a mother of 3 children. So I understand what kind of health needs come about in a family or personalized specific situation. Now, in terms of Medicare, we have to train every single year and get certified with every single carrier that we represent, because every year there are changes to Medicare. And it's important that you have to go through annual exams just to be able to represent the different carriers that offer these Medicare products. Regular brokers who are health insurance brokers, they sometimes don't even want to sell Medicare products because of the hours of time that it takes to be certified each year. So it does train us, it gives us updates and helps provide us the support that we're able to provide you, so that we are the most knowledgeable every year about all the changes that occur, because there are updates and changes to the Medicare products and plans being offered by the private insurance companies every single year. One of the things that's unique about working with a broker like myself is that we don't just help you with the plan and then that's the end of our relationship. I'm here for all of you throughout the year, not just during the different enrollment periods, but my clients know that they can contact me any time of the year, and hopefully moving forward with a long-term relationship where we continue to have annual reviews of all of your benefits to make sure that you're always having the most suitable plan. And so I look to see based on your individual needs, and that's what's really important, because when you're talking about individual needs, just like I know that you have specific medications, you have specific doctors, even a husband and wife in a couple, they may have different doctors, they may have different medication needs. And so every person is unique to what's the most suitable plan for them. And so we want to make sure that we entertain all of those areas of importance for you when we compare all the different options. And that's the unique benefit of working with someone who is a broker like myself, because I'm not biased towards any particular carrier. As Deepak was kind enough to illustrate, I only get compensated by the plan that you ultimately choose. And also one thing I wanted to note with that is that all the carriers compensate me the exact same amount. So there really is absolutely no bias and no risk for you to consult and have me guide you through the process. So let's get into Medicare itself. Now, some of the questions that are commonly asked to me: what is Medicare? Who is able to get Medicare? What does Medicare cover, for example? And the largest one, of course, is how much does Medicare cost? So we will definitely start to explore those options and discuss all those details. Other things that people want to know, of course, is where can they get coverage and how do you choose the coverage? So we're going to go through these questions and we'll get through it together, okay? So first thing is, when are you first eligible for Medicare? So the general member of Medicare is entitled to Medicare once they turn 65 years of age, or sometimes they're entitled to Medicare if they're under 65 and had a qualifying disability or a special situation. Also, the other criteria is that you have to be a US citizen or a legal resident who's lived in the United States for at least 5 consecutive years before you can become eligible for Medicare. One of the things I wanted to point out is that oftentimes, if you're not a US citizen born inside the United States, Medicare and Social Security will require you to provide documentation to verify your citizenship. So if you're a naturalized citizen, for example, you will have to provide your naturalization certificate and or a birth certificate so that they can verify that you are an actual citizen. One thing to note again about that, sometimes those who have naturalized have gone to the Social Security office and updated their records with Social Security at the time that they were naturalized. Other members may not know to do that. So you may encounter that. You might have to provide that documentation. So I would say that when you're ready to start enrolling in Medicare, you should have the documentation available to you so that you can indicate the naturalization date of when you became a citizen. That's very important because they will ask that question. So moving forward, in terms of the actual enrollment, the first time that you can enroll in Medicare is called the initial enrollment period. And it's a period of 7 months long. So the entire 7 months includes your birthday month, 3 months before your birthday month, and 3 months following your birthday month. If someone was born on the first of the month, for example, then you would be entitled even a month earlier than your birthday month to start your Medicare coverage. So let's give an example. If somebody was born in the month of April, they would then qualify to begin the process of enrolling in Medicare as of January of that year, because it's 3 months prior to your birthday month. And then they would have until the end of July until their initial enrollment period ends. That's the total 7 months. Now, Medicare will start always on the first day of your birthday month, no matter how early you sign up for Medicare. But the earliest you can enroll in Medicare is 3 months before your birthday month. And to repeat again, if you were born, let's say on April 1st, using that example, then you would actually qualify to start your enrollment with Medicare by December 1st, because you can start your Medicare coverage as of March 1st, since you were born on the first of the month. Okay, so your 7-month period advances by 1 month and ends 1 month earlier. That's how it would work. So in addition to the initial enrollment period of just enrolling in Medicare for coverage of A and B, and we'll get to what those coverages are, you also have the opportunity in that time frame to choose either a Medicare Advantage plan, a prescription drug plan, or a Medicare supplement plan and standalone prescription drug plan. So let's go to a little more detail into those options. Hold on 1 second. So again, this is just a quick visual of how you can see with your initial enrollment period. So you have your month here, the birthday month, and then you've got 3 months before and then 3 months after. So I just wanted to show you a little visual idea of how that looks. If we're in the month right now of April, we are starting the enrollment process for people who are eligible to begin their Medicare coverage on July 1st. So that's what we're starting. And each month it will move forward. Next month in May is the earliest that you can start applying for Medicare if you were born on August. So, and so forth, it continues on. Any of these kinds of questions, if you're unsure of your eligibility, then of course you can contact me and I can advise you about your specific situation. So let's talk about the parts of Medicare. When you first enroll in Medicare, you are entitled to Part A, which is hospital insurance, and Part B, which is medical insurance. Now, Part A helps to pay for hospital stays, skilled nursing care, hospice care, and a little bit of blood work, the first 3 pints to be exact. And then Part B helps to pay for all the doctor's visits in or outside of the hospital, any kind of outpatient surgical procedures, x-rays, exams, lab work, any kind of thing like an MRI or CT scan, that all falls under Part B. When you first enroll in Medicare, that's the image of the card that you will receive from Social Security. Once you've officially been enrolled, it will have your name and an assigned Medicare number, and it will indicate when your Part A hospital coverage and Part B medical coverage is going to commence. So that is what you should expect to have once you sign up for Medicare. Now, let's go into it a little bit further again, just to remind you, this is just original Medicare. So original Medicare only covers Part A and Part B. And original Medicare is an 80%, 20% co-insurance type of plan. So that means Medicare will pay 80% and you're responsible for 20% coverage, okay? Now, let's talk about the cost of what you can anticipate with just original Medicare. This is without any kind of supplemental coverage from an insurance. So with just original Medicare, Part A, if most people have worked for a minimum of 10 years or 40 pay quarters in their life and contributed to Social Security, Part A will have a 0 premium. So you will be entitled to Part A at 0 premium cost if you've contributed for that many years. Part A will have a deductible for a 60-day period of $1,484. And then subsequently, you will be charged a particular copayment amount for each day that you're there for days 61 through 90 on a consistent stay at the hospital after 60 days. Now, the $1,484 deductible, so you should know, is a 60-day period, which means if someone goes to the hospital in January and they're there for a week and then they return home, they're required immediately to pay the $1,484 deductible before Medicare pays their 80%, and then you pay 20%. And let's say you go back to the hospital in April of that same year. Well, you've exceeded the 60-day period. So you have to pay that deductible once again. So outside of 60 days, you're always going to be required to pay that deductible. So in terms of the limit or maximum out of pocket, if you're hospitalized, there is no out-of-pocket limit, which is meaning that if you, God forbid, have a catastrophic surgery that you need to have, it's a $250,000 that they're billing to Medicare, there is no cap that Medicare offers with original Medicare in terms of putting a ceiling or, again, a limit to what you have to pay. You are paying 20% of that $250,000 procedure or bill. So that's Part A of Medicare. Now, a lot of people, such as yourselves, who are working still and covered under group insurance, this is something that is important to note because it does get a little bit confusing of what Medicare to enroll in. So the ruling of Medicare is that if you are covered under group insurance and you work with a company that has a minimum of 20 or more employees, then you can just have Part A if you want to, and you can delay getting Part B. Okay, so people choose Part A because it's a good option for secondary coverage. You've assumed that they have worked and contributed, that they're going to have zero premium. So there is no risk to having Part A at that point. And it's just going to be a secondary coverage to your current group insurance coverage. So your group insurance coverage will pay whatever they need to pay, and they will supplement whatever Medicare doesn't pay as well. Those employees who have less than 20 employees in their company and are covered by group insurance, they must enroll in Part A and Part B in order to avoid any late enrollment penalties. Because Medicare for a company who has less than 20 employees is required to be the primary coverage, and the group insurance is meant to be secondary. Therefore, you have to have both A and B of Medicare. A lot of people get confused about this. Some people are told incorrect information and saying, well, if you're working and you're covered under group insurance, you're fine. You don't need any Part B, you can delay it. Please be aware that sometimes people are not clear with the information that they're providing you. It's very important that you relay exactly how many employees are part of your company and offering the group coverage. The group coverage that's offered to you must be something that's called creditable, which is a equal or greater value to what Medicare offers. So according to Medicare's guidelines, if your group insurance is creditable and you have more than 20 employees participating in the company and in the group insurance coverage plan, then you are protected from not enrolling in Part B and delaying it further and avoiding late penalties. Otherwise, you definitely want to enroll in both Part A and Part B. All right, I hope that's clear. Moving forward, let's talk about Part B. So Part B is something that you're not necessarily entitled to for zero premium. Anybody who's entitled to Part B has to pay a monthly premium at a minimum, which is $148.50 per month. What Social Security is going to do is they're going to look back at your income from 2 years prior to the current year, every single year, and they will determine whether or not you are required to pay an additional income-related premium above the $148.50 or whatever the standard Part B premium is for that year. So they will look back and there's an income threshold. Those of you who want more specific and selective information about your individual Part B estimated costs, please feel free to contact me directly and I can help you determine what that estimated cost will be. But this is the minimum Part B premium. If you're below the income threshold that they set, then you just would be required to pay the standard premium of the Part B for that year, which this year is $148.50. Now, Medicare Part B also has an annual deductible of $203 for the year. So once you pay the $203 deductible, then Medicare will start to pay their 80% coverage and you pay the 20%. So let's talk about the other costs involved. You are required, of course, to pay the 20% co-insurance, but addition to that, there's something called a Part B excess charge, where doctors have the ability and the right to charge the patients 15% above the negotiated cost with Medicare. So they are able to do that as well, and you're responsible for that with just regular Medicare, okay? So if you only had original Medicare, that's another indication of a gap that Medicare is not protecting you. They will not cover the excess charge. You will be responsible for that as well. And again, with Part B, similarly to Part A, there is no out-of-pocket limit or maximum. So you're paying 20% of whatever the costs are. So in terms of the group coverage, just touching upon that again, I wanted to reiterate that it's a good idea, even if you do qualify to delay the Part B, you may want to evaluate your benefits with your current group coverage. If you're paying per month more than the standard premium for Part B, that would be a good reason for you to evaluate if maybe Medicare's coverage is much better than the group coverage that you currently have. So it's something also to discuss. And again, you can contact me directly if you want to ask those questions about your personal coverage. So let's talk again about what types of coverage now are you entitled to. We've already discussed that Medicare itself, you can see, has many gaps that they don't cover, such as Part A deductibles, hospitalization copays, the 80-20%. So there are two options that you have once you are looking into some form of secondary coverage. The first option on the left, we'll touch upon in red, is a Medicare supplement insurance plan, also known as a Medigap plan. This is like a PPO plan on steroids, okay, for the purpose of you understanding. A lot of people are commonly familiar with PPO plans, with their group insurance plans, and they know that they have to be within a network, and as long as they're in the network, then they'll be covered. The way the Medicare supplement plan works is that there is absolutely no network. You are entitled to go to any doctor, specialist, facility that contracts with Medicare. As long as they contract with Medicare and accept Medicare, you can go to that physician or specialist or hospital or facility, not just, of course, in California, but anywhere in the country. So it is very unique and very different than a regular PPO plan because it just expands your options. Now, somebody who chooses this option, Medicare would be your primary coverage. So you would have A and B of original Medicare, and then you would have the Medicare supplement plan, which would help supplement the costs that Medicare does not cover, such as the Part A deductible, such as the Part A hospitalization copays after 60 days. It eliminates that 60-day period, of course, where you have to pay a deductible each time. And the nice thing about the Medicare supplement plan, of course, is that it does not have any maximum out of pocket except for the annual deductible for Part B. The annual deductible for Part B was a new law that came into effect in 2020, that anyone who has a Medicare supplement plan beginning in 2020, they would be required to pay the annual Part B deductible. So for this year, that's $203. Once you meet that deductible, Medicare is paying their 80%. The supplemental plan will pay the remaining balance of any of your bills that are Medicare approved bills. And that's it. So there is no out-of-pocket maximum needed for you because the maximum that you have to spend is just $203 for the year. So that's what's a really unique feature to the Medicare supplement product. Now, the Medicare supplement product does not include drug coverage, and Medicare members are required to have a Part D or drug coverage plan even those members who do not take any medications, they are still required to have some kind of drug coverage that is considered creditable. And we want to make sure that you have that so that you avoid any late enrollment penalties for the Part D as well. So Medicare supplement plans only cover the medical portion of the supplement. So you need to have a standalone drug plan if you choose this option. And the standalone drug plans vary, and they are only offered by private insurance companies. But again, this is where I help and work with my clients so that you can compare all the different prescription drug plan options available, and that way we can find the most suitable plan for your needs. Now, let's talk about option 2. Option 2 on the right is the blue, and that is called a Medicare Advantage plan. The Medicare Advantage plan also is known as a Part C plan, okay? So whenever you see Part C, that means Medicare Advantage. This is most likely what you're being bombarded with right now in the mail if you are at the age of turning 65. Just every company known to man is calling you and sending you material about Part C plans. When you see promises on the commercials or radio or the letters that come to you offering 0 copay, 0 premiums, 0, and you have vision and hearing and dental and Part B rebates, those kinds of benefits are generally offered with Medicare Advantage plans. The Medicare Advantage plans are generally an HMO-based plan. So it's the opposite of a Medicare supplement plan. The Medicare Advantage plans, as much as they are very affordable, they also can be restrictive because you are restricted to a specific network or medical group, and you have to assign yourself a primary care physician. And that primary care physician's affiliated medical group is where you will be receiving authorizations and referrals to get medical care. So Medicare Advantage can be affordable and more affordable in terms of someone who has a more limited income, but it is also more restrictive. So if you have a lot of doctors who are affiliated with various medical groups, Medicare Advantage might restrict you from being able to continue seeing all those same doctors. A Medicare supplement plan in that circumstance would be a better option for someone who doesn't want any restriction on the doctors they're currently seeing. But we always take a look, and that's the first thing that I do. I always want to make sure that you can stay with the doctors that you have, because there's no point in finding you a plan if your doctor doesn't work with it, unless you're open to changing doctors. But primarily, we want you to stay with someone you've had continuity of care with so that you can continue to have that quality of care that you've been accustomed to. So that's the different options. Now, to clarify with Medicare Advantage, you can see that the Part C plan combines Part A and Part B into one plan, and it also includes Part D. So it is a comprehensive plan. If you are comparing the two, again, remember Medicare supplement does not include drug coverage, so you have to get Part D plan separately from the Medicare supplement plan. The Medicare supplement plan does have a monthly premium that you'd be required to pay for the luxury that you're getting of having that flexibility of options for doctors and specialists. So you would have a premium for the Medicare supplement plan that ranges in price anywhere between $95 up to $160. And then you would have a premium for Part D plan as well. So it's something to consider if you are concerned about your fiscal expense and responsibility. Medicare supplement would definitely be a higher cost to you. Okay. So let's talk about some quick facts again about a Medicare Advantage plan, also known as Part C. This was the one that's like an HMO. So you must be enrolled in Medicare Part A and Part B in order to be eligible to have a Part C or Medicare Advantage plan. And you also have to live in the plan's service area. You also can't be denied any coverage based on your current financial status, your health status, including pre-existing conditions. They do not ask you any questions whatsoever. You're going to be required, as we said, to use their provider and pharmacy network. And the coverage and costs vary by plan and may charge a premium per year depending on the county that you live in and the plans that are offered in your county. There is a maximum out of pocket for a Medicare Advantage plan. So there is a ceiling in terms of how much you have to pay, which is nice. So that supplements the no ceiling or no maximum out of pocket that original Medicare does not offer. And you also have to continue to pay your Part B premium so that you can maintain that coverage with Medicare. Okay. Now the Medicare supplement, some quick facts is that it does help to supplement the costs that are not paid by Medicare. It supplements the original Medicare's Part A and Part B deductible costs of Part A, and also the co-payments that you would have and the 20% co-insurance that you would have. It cannot be combined with a Medicare Advantage plan. This is something very important. You're unable legally to have both a Medicare supplement plan and also a Medicare Advantage plan at the same time. So you have to choose between one or the other. Now, in the Medicare supplement world, as of now, the Plan G or versions of Plan G is the Cadillac plan of the Medicare supplement world. And the benefits of each plan that's offered with Medicare supplement plans are regulated nationally. So they are the same benefits universally across the country. There are certain carriers that offer just a standard Plan G, and then others offer different variations of Plan G with potentially more benefits offered. These are all plans that are only available through private insurance companies, okay? Now, let's talk about the Part D coverage. So again, there's two ways to get this coverage. Either you were choosing a standalone Part D plan to original Medicare that you would have with a combination of a Medicare supplement plan, or you can choose a Medicare Advantage plan that includes the prescription drug coverage. And again, Part D plans are only offered through private insurance companies. So let's talk about the importance of the Part D of Medicare. Oftentimes when people take medications, or if they don't take medications, what we're really looking for is what level or tier that your medication falls on. So every single drug company that's offering a plan with Medicare offers a formulary, which is a list of the covered drugs that they offer. And each medication will fall on the formulary tiers. So as you can see, tier 1 is the lowest cost tier. Tier 2 is a little higher. Tier 3 is generally brand name, preferred brand name medications. Tier 4, also general brand name, and tier 5 are specialty. The higher the tier, the higher the cost of your out-of-pocket expense. So on a tier 1 or a tier 2, generally you're going to be paying maybe $0 copay, $5 copay, sometimes a $10 copay. And then tier 3 will get significantly higher at either $40 to $47 copay. And tier 4 would ultimately be a $100 copay or a percentage of the cost of the medication. Now, the lower the tier, again, the lower the cost. And there are deductibles for the Part D plan. So this year, the annual deductible is $445. Now, if you have medications that fall on the very low tiers, such as tier 1 or generally tier 2, you're able to waive the deductible and they will not make you responsible to pay that. But once you have a medication that falls on tier 3 or higher, they will require you to pay the deductible first before the insurance starts paying their co-insurance of the cost of that medication. Okay? So let's talk about the different stages of Medicare's Part D plans, and this is very important. The first stage, as we touched upon, is the annual deductible. If you, again, are healthy, you're either not taking any medications, or if you have had medications that are low cost, preferred generic medications, you immediately bypass the first stage of the deductible stage because you're not required to pay it, and you'll go into the initial coverage stage. So in the initial coverage stage, Medicare, not the private insurance company, Medicare is tracking how much you're spending out of pocket on your medication. And they're not only looking at the copayment that you pay, but they're also looking at what the insurance company is paying to supplement the difference in retail costs. So let's take an example. If a medication is costing you on a copay level $5 because it's a low cost medication, but the retail cost of the medication is actually $20. That $10 from the insurance company that they're paying and your $5 combined is going to, I'm sorry, the $15 from the insurance company and the $5 that you're paying combined is going to be accounted for by Medicare. So the total $20 cost they're going to account for, even though you're not paying $20 out of your own pocket. Once your costs reach $4,130, then they're going to put you into the next stage. And this is a stage that we really are trying to avoid. This is called the donut hole or the coverage gap stage. And in the coverage gap stage, the reason why we try to avoid this is because your out-of-pocket responsibility for your medications is no longer a flat copay, but it's 25% coinsurance of the cost of the medication, the retail cost. So when someone has some expensive medications, such as a diabetic or someone with a chronic condition, that definitely can add up at 25% of the cost. And they continue to track how much retail cost value your medications are costing the insurance and you until you reach $6,550. Then they put you into the fourth and final stage called the catastrophic stage. In the catastrophic stage, they reduce the cost of your medications and they charge you either a flat copay of $3.70 for generic drugs or $8.90, or they might charge you 5% of the retail cost, whichever is higher of those three options. This is something that happens every January 1st through December 31st. So the cycle begins again every January, and they track all this information between the full 12 months of the year. So it's going to determine what your costs are based on what stage you fall into, okay? And the dollar limits will change each year. Sometimes people will not reach the coverage gap because they're healthy, they're taking low-cost medications, they'll never even have to reach that level or the deductible level for that matter. Others that do, there's different ways that we can work with them to limit their costs and find a plan that covers their medication at the most suitable level. So that's something that I work with my clients on as well if they do have some expensive medication. So let's talk about enrollment periods. What if I go into a plan and in the middle of the year, my doctor prescribes me a medication that all of a sudden is very expensive? Am I stuck with the plan that I have? And the answer is no. You are not locked into the plan that you choose for life. There are many different enrollment periods. So the general annual enrollment period is most commonly available between October 15th through December 7th of each year. This time period is where you have the option to review your benefits. You can change, you can drop the plan that you have, go back into original Medicare, and whatever changes you make, they go into effect January of the following year. So that's when you have the opportunity to find a more suitable plan if necessary, or switch if you wanted to from a Medicare Advantage plan to a Medicare Supplement plan. Now, there's also a Medicare Advantage open enrollment period that is between January 1st and March 31st. For this particular period, it's very limited. It's only from somebody who has a Medicare Advantage plan who wants to either switch and change to another Medicare Advantage plan or go into original Medicare and get into a prescription drug plan at that time. But if you have no Medicare Advantage plan at that time, you cannot switch from original Medicare into a Medicare Advantage plan at that time. It is only during the annual enrollment period. If you are exceeding either of these enrollment periods and you've missed the opportunity, then there's always a special enrollment period that you're entitled to enroll in Medicare, either losing your employer coverage or retiring if you move out of the area, if you are on Medi-Cal, receiving assistance from the state, or you have been diagnosed with certain qualifying chronic conditions. So those all are special circumstances that would allow you another optional enrollment period. One thing to note about the initial enrollment period that we touched upon, when you first become 65, that 7-month period, I wanted to mention, if you miss that first 7-month period, let's say your birthday is in April, and you have until May, June, July to enroll in Medicare, and you miss that opportunity, you will then have to wait until the general enrollment period, which is between January 1st and March 31st of the next year. And your Medicare Part B will not go into effect until July 1st of that same year. So you definitely want to make sure you enroll when you're first initially entitled to, or find out if you can delay that coverage so you avoid any penalties. Okay. So the next thing just to know is just to consider what options are best for you personally. Is it the right thing to do to stay on your group coverage? Is it the right thing to do to enroll in Medicare A and B? These are all things that we can discuss together, and I can advise you on, individually if you have specific questions. And again, I just wanted to share with you my information over here. If you'd like, you can even go into this address and you can go into my Calendly calendar and schedule an appointment to have a one-on-one conversation about your specific needs. So I'm just going to look at some questions if they did come up. So Deepak asked the question in terms of Medicare Advantage, I guess, or versus Medicare. Deepak, do you want to clarify? Are you asking original Medicare versus Medicare Advantage?
Yeah. You were comparing the, what was the Medicare, what was that plan name?
The supplement?
Red supplement, yeah. So red one versus the blue one. And
right.
So looking at the advantages and disadvantages, although the red one, the supplement plan, seems very appealing because you can go to any doctor and so on, but it comes with the burden of Part D.
A premium. It comes with the burden of paying a separate premium for Part D and also a premium for the Medicare supplement plan.
Right.
However, it gives you much richer coverage in terms of the flexibility to choose doctors and the network. In Contra Costa specifically, it's a small amount of Medicare Advantage plans available to members. And depending on the county that you're in, Santa Clara County will have different options of Medicare Advantage plans, a lot richer coverage options. San Joaquin and Stanislaus are different as well. So it really depends on the county that you're in. And we can advise you based on your needs. Your medication costs might be more expensive on a standalone drug plan than a Medicare Advantage plan, but the Medicare Advantage plan itself might have a higher premium, and you might be paying more copays out of pocket ultimately if you go to the doctor regularly. Then you want to weigh the different options for each particular member because everyone has a different situation. So generally, I would say that the way you want to determine what's the best option for you is to determine what is more important to you. Is affordability more important to you, or is flexibility more important to you? And that really helps you determine what's a better option.
Okay, so the follow-up question then is that in Advantage plan, you have the eye and dental and hearing covered.
Yes.
While if you are with the supplement, then you have to buy it separate, right? That's additional.
So there are supplemental plans that offer vision and hearing and over-the-counter benefits, and so a lot of similar benefits that the Advantage plan offers. The supplemental plan is starting to offer as well. They do not include dental plans at the supplemental plan. Although I will say that the dental plans offered by the HMO plans with Medicare Advantage are HMO dental plans. So it's very possible that your dentist may not work with that particular HMO plan because it's a more restrictive network than a PPO network.
Okay, so one basic difference is if you want to keep your doctor, or you just want to trust the doctor who's participating in the Advantage HMO plan.
Right, you can do that, and if you're open to being restricted to the network that your doctor is affiliated with, then Medicare Advantage might work for that member. Some people want the ability, if they'd like to have their doctor in one county, and if they wanted to go to Stanford, they can go to Stanford and see another doctor. They like that fact that they have the flexibility to go to the top doctor in the country if they want to. With a Medicare Advantage plan, you don't have that flexibility. You are stuck with that area that you're in, and whichever medical group that you're affiliated with through your primary care physician, that's who you are with. A prime example, let's say somebody has a fall, something commonly happening to people as they get older, and they break their hip and they go to the hospital. The hospital on an HMO plan, you can go to any hospital in an emergency situation. So that's not restricted. However, if you need to be discharged and sent to a skilled nursing facility to continue having skilled care, you are going to be limited to whoever is contracted with the company that you're with and with the medical group that you're with. And you may not be satisfied with that care, but that's who you need to remain with. That is where the restriction comes into place. Same with physical therapy, same with anyone providing in-home health support services of physical therapy to your home. If you have a Medicare supplement plan, however, you have the flexibility to say, well, I want to go to this particular skilled nursing facility. I don't want to go to this one. I've heard better reviews about this one. And that's really, you're paying for that quality of option. The Medicare Advantage plan does not offer that at all. Okay. So that's where the restriction comes into play.
Thank you, Sabina. I'm beginning to understand it a lot better. There are
sure.
questions.
Yes.
Can you see the question in the box there?
I am. So let me, you asked how expensive is Part D. I want
that
to
was me, and that's okay.
Oh, okay.
I think you can go to the next question.
Okay, so we'll skip that. I can talk. Yes?
Can we stop?
Sabina, I have a question.
There are two questions.
In Part A, even though I'm covered by a group plan. So again, I wanted to clarify, it's very particular based on how many employees are part of your company that you're covered by the group insurance plan. If you have 20 employees or more, then you don't necessarily have to enroll in Part A if you don't want to. You can delay it. There are lots of people who just delay the Part A coverage as well. But a lot of people choose to enroll in it because it's free, it's zero premium, and there's no risk to having it. It's just considered a secondary coverage, and it's just getting them started in the process of having Medicare. But that's a personal choice that you can make for yourself in that circumstance. So the answer again, you don't have to enroll in Part A, but some people choose to just to have it as a secondary coverage. Now, if you leave your job in between, okay, so this is an important question. Someone asked, if you leave the job in the middle of the month, let's say like May 13th, how long would it take to get approved for Part B and then later the Advantage plan? This is very important. It takes a long time. If you leave a job, let's say, and want to apply for Medicare right away for June 1st, as an example, doing it in the middle of May is already too late. You could potentially be covered June 1st with original Medicare. They'll retroactively start to cover you. However, in order to be able to get into an Advantage plan or a Medicare supplement plan, they must have your available Medicare assigned number. And it takes Social Security a good at least 3 weeks to assign a Medicare number to you in terms of processing. If you have other circumstances where you need to provide naturalization documents to Social Security under review, that could delay the process further. So my recommendation, if you are, let's say, planning on retiring, you always want to start enrolling in Medicare at least 3 months before you're planning on retiring. So if, let's say, you want to start with your new coverage June 1st, and you want everything to be starting together, your secondary coverage, your Medicare coverage, start 3 months before with the process of enrolling in Medicare after leaving a group insurance plan. It's a general rule that I definitely advise because it gives you time to process. I just had a client right now who is turning 65. He is a naturalized citizen and he's followed all the rules, but it takes a while sometimes for the government organization to process things. And he had to send them documentation, even though he sent it in a timely manner, they were still processing it. This was in February and he's meant to start in May. So I just wanted to make it clear that you definitely want to give yourself more time because within 2 weeks of losing the coverage, let's say somebody is laid off from a job, God forbid, okay? And the company is saying, you're only gonna have insurance coverage until the end of the month. That's a circumstance you can't avoid. You start the process of enrolling in Medicare as soon as you can. But one thing to note, the company is required by law to cover you with COBRA. So as long as you enroll in Medicare right when you get, lose the coverage on involuntarily, then you're not going to have any late penalties. It just means you may have to delay starting your secondary coverage a month later until Social Security catches up and assigns you the number. But we can work together on that, and I can help guide you through that process.
Girija, next in line.
Yes.
Sabina, I'm taking the questions as they are coming in preference. So,
Sure.
Guptaji, and then
I'll stop the screen sharing they asked. Let me stop that.
Yeah.
Yeah.
Okay. Hi.
Hi, Sabina.
Yes.
Hi, Sabina.
Hi,
I
how are
already
you?
wrote you, but I have a question regarding it. Is that I'm doing fine. Thank you for a very needed topic.
You're
I
very
already
welcome.
have a supplement F. I got it exactly, and they said that supplement F was being taken off, and but
Okay.
I was grandfathered into it, and I was led to believe it is the best supplement, but I don't have dental or a vision in it. So are
Okay.
there something available better that might cover it?
Yeah, so I
The
wanted to touch
dental
upon
and
what,
the vision?
yes. So the answer is yes, there is, depending on the carrier. Also, I wanted to address what you mentioned about the Plan F, like Frank, that you're mentioning. So
Yes.
for members who were born before January of 1955, they were entitled to a plan called the F as in Frank plan with a Medicare supplement plan. But the government passed the law and they said as of January 1st of 2020, so anyone born after January 1st of 1955, they are no longer eligible to enroll in the F as in Frank plan. The F used to be the best plan option available. And the difference between the F and the G only is that annual Part B deductible. So when you have an F plan, you're not required to pay any deductible, not for A or B. But with the F plan now being discontinued for new members to Medicare, the G plan is now the top plan available. For those of you who have the F plan but do not have any kind of vision or hearing benefit, there are a couple of carriers who do offer it. So if you want to contact me privately, we can talk about what your options are in obtaining that.
So there will be a new premium for that part of the private insurance for dental and vision?
So I will tell you that for supplemental plans, the Medicare supplement, they don't offer any embedded dental plan. You have to always pay a separate premium for the dental plans that are offered. But for vision and hearing, there are certain plans that embed the vision and hearing benefit. And there's no additional premium for that. Yes.
And other question was that Medicare does not cover any treatment in the foreign land, like you go on a vacation, you fall sick.
Mm-hmm.
So do the Medicare Advantage or the Medicare Plain?
Yes.
Cover
So the
any of that?
Medicare supplement plan offers limited foreign travel coverage for emergency medical services. Generally, the coverage is only up to about $50,000 per lifetime for Medicare supplement. If you have a Medicare Advantage plan, some plans offer anywhere between $7,800 annually up to $50,000 annually. But what I always recommend, honestly, is to get a travel medical policy. And those policies that I work with my clients, I enroll them in a policy that gives them a benefit that's $250,000 medical coverage or $500,000 medical coverage. So it's a much higher benefit that gives them much more protection. Also, one thing to note about the emergency worldwide services, these plans do not offer any coverage for, God forbid, being transported back to the States if you need to be, or repatriation. The medical travel policies do provide that coverage. So that's why I always recommend that in that circumstance.
I was led to believe that Plan F had that provision that they will have give you free ambulance from, like if you are somewhere outside of United States. to transport you by ambulance to the United States?
No, to my knowledge, they don't do repatriation or transportation back to the States.
Would seriously doubt that because, a couple of my patients have gone through that situation and that this was not covered by anybody else, actually.
Yeah, they're not covered by that. Only a travel medical policy would cover that. But the travel coverage that's available to you worldwide with a supplemental plan like you have, it's only $50,000 lifetime coverage. And they have a down payment of $250 usually that you have to pay. After you utilize the $50,000, you're responsible for 20% of all your fees.
And how about the long-term care or something like rehabilitation? So
long-term care insurance is a completely different type of insurance
no,
than
I
Medicare.
didn't mean that. No. For instance, if you get sick and you go to for temporary rehab and it takes longer than allowed.
Okay, so that's called skilled nursing facility care.
Yes.
When you're discharged from a hospital, a Medicare supplement plan will provide you care at zero cost to you up to 100 days. Outside of 100 days, then it will be your responsibility for the cost unless you go back to home, you're being discharged from the skilled nursing facility, and then you're back in the hospital for another 3 days minimum. You have to have a 3-day minimum stay in the hospital in between stays, and then it starts all over again. But if the doctor who discharges you from the hospital is putting you back in the skilled nursing facility for the same reason as your initial stay, they may not cover that. It has to be a completely different reason for going to the skilled nursing facility, a new medical issue.
Yeah, sorry to interrupt, but do they cover anything in-home help? Like, for instance, you do come home and they pay for the care.
Yes, so the kind of care that qualifies in-home health support services is primarily physical therapy in the home, occupational therapy services, wound dressing. If somebody has a catheter, for example, or oxygen machine, they need to address changing these things. That would be available for some limited skilled nursing care to come into the home and set up some visits at a limited amount. But when we talk about day-to-day activities such as bathing, dressing, feeding, going to the bathroom, those are not covered by Medicare whatsoever.
But does the supplement F or any supplement in the other plan, the red one, Medigap, does any one of them do better than the plain Medicare's?
No, the supplemental plan will definitely provide more coverage than regular Medicare. But remember, Medicare is your primary coverage with a supplemental plan. So you are already in receiving benefits from Medicare. The supplemental plan is just supplementing the cost from your pocket and your expense. That's how it's working for you and your benefit. But in terms of the skilled nursing care, again, it's covered for the home up to a limited amount of whatever Medicare approves, that will be covered by your supplemental plan. But, other than that, day-to-day activities of life, that's more of a long-term care policy.
Thank you so much. Thank you for your patience, knowledge.
Of course. My pleasure.
Gupta, thank you for waiting patiently. You are up next.
Okay.
Ms. Levine,
Yes.
did you find it difficult for people to initially start with the plan F, then go to HMO type of plan, try it for a year or two, then try to come back to F with a serious health issue? Have you seen it?
That's an excellent question. Okay, I'm glad that you brought that up. So just to reiterate, very often the question comes into play, can I switch from one plan to the other? A Medicare Advantage to a Medicare supplement or vice versa? And the answer is a little complicated, so I'll try to simplify. If somebody wants to switch to a Medicare Advantage plan, it is very simple to switch to a Medicare Advantage plan from a Medicare supplement. You can always go to a Medicare Advantage plan during the enrollment periods of when you're supposed to enroll in it. And they don't ask you any health questions whatsoever. You can have severe health condition and you will always be accepted into a Medicare Advantage plan. I cannot say the opposite way. So there are certain opportunities to have a Medicare supplement plan at a opportunity called guaranteed acceptance, okay? One of them is primarily when you turn 65, you have a guaranteed acceptance opportunity to enroll in a Medicare supplement plan. Even if you have severe health issues at that time, they cannot deny you. They have to accept you in the plan. Now, let's say you're on that Medicare supplement plan and it gets a little bit more expensive than you were anticipating, and you want to now switch to a Medicare Advantage plan. You're on the Medicare Advantage plan. You have only a limited amount of years that you can be on a Medicare Advantage plan and switch back to a Medicare supplement plan, to the plan you had before, with also a guaranteed acceptance and no health questions. So some carriers require that you have to go back to that plan within 12 months. Some plans allow you 2 years, but that's the most that I've seen. A maximum of 2 years for a particular carrier will allow you to go back from a Medicare Advantage plan back to the supplemental plan. Outside of those timeframes, if you exceeded the 2 years, you would have to go through underwriting to go back to a Medicare supplement plan, and you could potentially be denied the coverage. Now, just to give you a little bit of hope, sometimes there are circumstances where Medicare supplement plans will offer promotional loopholes and limited underwriting holidays, but that is not something that's guaranteed every year. So it is always a risk to do that. It's a risk to go from a supplement to an advantage and stay on it for longer than the limited time. Did that answer your question?
Yes, thank you much.
Oh, very much so.
There are a couple of questions in the box that we
Yes.
lapsed to us. One from Ms. Krishnan.
Satish,
I'm
I
planning.
think
Oh, no, his is coming down here. Jalotaji, did you put a question there? I don't see it, but there is a question here as you look. I'm planning to retire in August. Should I start
Yes.
now in Medicare?
Okay, so the answer is you have 7 months from your initial enrollment period. So if your birthday, well, the question is, I'm not sure if you're turning 65 in August and that's when you're planning on retiring, or if you are on a group plan and you have already passed the age of 65. So that's a little complicated question.
No, I'll be 65. I'll be 65 in June, on June 10th.
Oh, in June, but you want to retire in August, you're saying?
August. Yeah.
Okay, it's a complicated time frame, and I'll explain why. Technically, it's complicated. Technically, you can apply for Medicare in August if you want to, but if you apply now for Medicare, they're going to assume that you're starting your coverage June 1st because your birthday is in June. And we haven't gotten to the month of May yet. So if you wait till your birthday month to apply for Medicare, then they will start your Medicare the first of the following month for Part B of Medicare. If you wait 1 month after your birthday month, they will start your Medicare Part B 2 months after. And then if 2 months, if you wait, let's say till July or August, they will start your Medicare Part B 3 months from the date that you apply. So if you apply in August for Medicare, they're not going to start your Part B coverage until 3 months later. So you want to plan it out. If you want to start your coverage in August, I would say the best time to start the process of enrolling in Medicare, let's see, it's June is your birthday, July, I would say start in July. No, it's complicated because if you apply in June, they'll start you in July. But if you start in July, they'll start you September.
Why it is 3 months after my birthday, I can still do it, no?
You can still apply without getting a penalty and they will process your enrollment, but they won't do it for immediately the month following the time that you apply if you do it after your birthday month. So they delay it.
Oh, they take 2 months to process my Medicaid card?
They will, it's not about the 2 months to process. They're telling you that because you applied later in your initial enrollment period, they're going to now postpone your Part B coverage.
Even though if I enroll in Part A, suppose
Even if you enroll in Part A, yeah.
even though I enroll in Part A, but still Part B, they will delay it.
They will delay it. You can try, because you're having a unique circumstance. I think the best thing for you to do is to explain to a representative over the phone and have an over the phone appointment. Because if you do it the standard way, their system is just going to automatically assume you want both A and B, and it's complicated. You can contact me and I can explain it to you in terms of your circumstance more specifically.
Okay. Thank you.
You're welcome. Yeah.
Next is Jalota ji. I apologize. I jumped one question over you, Jalota ji. So please go ahead. I can read your question if you want. Why Medicare? Okay, go ahead. Why Medicare does not cover dental care for people over 65, which is the age when dental problems start accumulating? Why this discrimination?
So it's a good question. Unfortunately, I can't speak to why the government decides not to offer certain coverages for certain benefits. To be quite honest, Medicare does not cover many things. They don't cover dental care. They don't cover vision in terms of prescription glasses. They don't cover hearing aid coverage either. There's lots of things that Medicare does not cover, and that's why these private insurance companies offer additional benefits that Medicare does not provide. They're the ones who are offering the over-the-counter benefits, the telehealth benefits, the vision and hearing. At some time, they offer acupuncture benefits, chiropractic benefits, that Medicare doesn't cover these things. So I can't speak to why they don't. What I can say is that my opinion in terms of dental coverage in general, I don't find that there is a lot of value to dental insurance plans, even standalone dental insurance plans. I can sell me one, but most of them have a waiting period of 6 to 12 months for any major services. So you're required to pay a premium for that amount of time and possibly an annual deductible without being able to utilize the benefits right away. And even once you've waited the period of time that's allotted, they only cover 50% and up to $1,500. That's it. So you're paying a lot of money out of pocket to have very limited coverage. To me, it doesn't make sense. Most of my clients, I advise them to talk to their dental provider and work with them in creating a treatment plan that could provide them possibly a payment plan with no interest or some form of a discount if you're paying in cash. The only kind of dental plans that are rich in coverage that I've seen are the group insurance dental coverage, because the size of the group allows them to offer more rich benefits with the dental coverage available. The group dental plans generally don't have any waiting periods, and you can immediately start receiving benefits right away. But for individual dental plans provided or offered as an optional premium from supplemental plans or the embedded plans from the dental HMO plans, it's minimal coverage and you still have to pay a lot out of pocket for those. And you're limited to the network that you have as well. Did that answer your question?
Yes, ma'am. Yeah.
Oh, okay, wonderful.
Okay, Gupta ji, you're next up because you have a question and I have, I think, one here too.
I just want to make a statement. First of all, I do not know Sabina. So what I'm saying is what is I have experienced in last 7-8 years on a Medicare.
Okay.
I have found that it is a great advantage to work with a Medicare, Medicaid agent like Sabina and others to find out not only the proper coverage, but also, like for example, I have an agent. He helps me fill out all the application every year. He helps me find the best D coverage. Matter of fact, I take lots of very, very expensive medication, even up to tier 4, tier 5. And it changes all the time. And he helps me to change Part D almost every year, depending on my medications. He helped me fill the application out. So whoever, my experience is, it's an advantage to use someone to help you other than trying to figure out yourself. Thank you.
Thank you so much. Yes,
So
that's what we do.
there's a question in the box. What would be the premium for the travel plan? And similar question about the premium, but also for dental and hearing and vision for what's the premium by the private insurers?
Okay, so for travel insurance, it ranges in premium based on the duration of your trip, how many people are going, and what ages the travelers are. So that's really a very unique question. I would say if you want to contact me to kind of get an assessment for your own travel plans that you have, then I can provide you that information. But they range in price anywhere from $140 for 2 people up to $600 to $800, depending if you want cancellation coverage and reimbursement of fees that you've prepaid in case you have to cancel the trips for medical reasons. So it varies. Yeah, but you can contact me directly if you'd like, and I can give you an estimate of cost. And I see here, what are the premiums for those private insurers who cover dental, hearing, or vision? Again, the premiums for the dental, I would say, they range in price anywhere between $32 a month up to $75 to $120 a month. It depends on what is the maximum benefit that you're looking for. Some plans offer a $2,500 benefit, but the cost might be $115 a month for one person. So it's something that if you'd like, I can consult with you and give you an idea of what options and premiums there are for the dental coverage. In terms of hearing and vision, generally they don't combine hearing and vision in the same coverage, but with Medicare supplement plans, they do offer hearing and vision coverage. And for Medicare Advantage plans, they do offer hearing and vision coverage. But standalone plans that you purchase independently, they don't generally cover hearing and vision together. Vision they do with dental usually as a bundle. That's what they offer. But I find that it doesn't pay to get separate vision coverage because the vision coverage provided to you by the supplemental plans or the Advantage plans are sufficient.
So Sabina, that was just a wonderful presentation, extremely informative, and of course created a lot of interest. And you heard the Q&A session, and you've been talking completely breathless at this point, trying to answer all the questions and queries. And I'm sure there will be many more questions, but as you said, people will be able to contact you directly. And this is the unique, everybody has unique situations. So we don't want to hold others who are not interested in hearing about, let's say, my personal situation. So I want to thank you profusely for spending your invaluable time with us. And thank you on behalf of all of us here and the ADS. So
thank you.
I would like to close this session at this point. We're to the recording part of it. Sabina, you're welcome to stay.